Hi and welcome. I'm trying to learn medicine. Today, Bornholm disease. And after we've done it, we're gonna do Neckstretching. And if you participate in the Neckstretching, then it's better the honors. Bornholm, and yes, we're talking about diseases. And this is no medical advice, we're just learning about diseases. Bornholm disease. A painful virus infection that may occur in epidemic form and which mainly affects children and young adults. It gets its name from Bornholm, a Danish island in the Baltic Sea, where it was first identified. It is also known as devil's grip, epidemic virgia, and pleurodynia. Okay, first the Baltic Sea, there's Europe, and then in the middle there's France, and there's Germany, and north of Germany there's Denmark, and west of Denmark there's the North Sea, and east of Denmark there's the Baltic Sea. And then the Baltic Sea there is an island called Bornholm. And that was first discovered, identified. Okay, that is a painful virus infection affecting mostly children and young adults. It has also the name devil's grip, epidemic virgia, and pleurodynia. Symptoms: sudden attacks of severe pain in the upper abdomen or chest. So sudden attacks of severe pain in the upper abdomen or chest. Rapid, shallow breathing with increased pain or deep breathing, laughing or yawning. High temperature. Profuse sweating. I don't know what profuse. I heard it a lot of times, but I don't know what it means. Profuse sweating. There may be a slight cough, but there will be no vomiting. That's nice. Just let me point that out. So these things are excluded. What if people have two diseases? What if the only reason why someone says you do not have Bornholm disease is because this person has hooked up with the last time? But maybe they have just two diseases at the same time. I don't know. Incubation period, 3 to 5 days. So after, no, I'm not completely sure what the incubation is. That is the period until it breaks out. 3 to 5 days from the infection until it breaks out. Duration, 3 to 7 days. Causes: a virus spread by direct contact, especially coughing and sneezing. So for the air, mostly. Complications. As with many virus diseases, infections of the pleura, I don't know if pleura is or what it is, actually never heard of it before. Infection of the pleura, lungs, heart, brain, or liver occasionally occur. Okay, it can infect the pleura, the lungs, the heart, the brain, and liver. Treatment in the home. Rest. Take pain-killing tablets in doses recommended on the container. And again, this is no medical advice, this is a shit in here. Hold a hot water bottle wrapped so as to prevent burning the skin. Yeah. If you take a hot water bottle, you should not handle it in a way that you burn yourself with hot water. Against the most painful area to ease the pain, do they also advise? And when to consult a doctor? Immediately, if there is severe chest pain or abdominal pain. What the doctor might do: examine the patient to make sure he or she is not suffering from another illness with similar symptoms, such as pneumonia or appendicitis. We had appendicitis, that is inflammation of the appendix at the beginning of large intestine. I don't really remember what causes it. I think we didn't really know the cause. So the doctor tries to rule pneumonia or appendicitis. Prescribe strong painkillers once the diagnosis is certain. Prevention: avoid contact with affected individuals. Outlook: recovery is complete within a few days. And relapses may occur soon after apparent recovery. What type of disease is it? So people recover when they get it again. How does it happen? That's really an interesting question. Probably more for biology. Why do some diseases come back? Imagine if we find the answer to that, even if it are very simple diseases. It doesn't have to be Bornholm disease, just any. Maybe it would explain why many other things are coming chronic, or why things like multiple sclerosis come in steps and stages. Okay, Bornholm disease. It seems to actually. I think that's so dramatically. I mean, at the end, she recovers complete within a few days. But maybe there's more to it. They just don't write it down. Now that was Bornholm disease. If you were here for medicine, when you come already to the next part of medicine, we will do now the Neckstretching. You should do some arm stretching. Neckstretching. We are making the hydrotower. If you participate in the Neckstretching, then it's better the arm. Good and stable side. And we are doing the hydrotower. Breathe in and reach the fingertips as far as you can. Reach high up with the fingertips and reach far. Bring it up. And again, and reach as far as you can with the fingertips. And down again. Reach as far as you can. Next exercise. Reach again with the fingertips as far as you can. As you're doing a big arm circle. Reach as far as you can. Not only to the sides, also back, reach back and reach with the fingertips. Reach as far down as you can. And another round. Reach as much in front as you can with the fingertips. And reach high with the fingertips. And not just to the side, but also back. Reach as far as you can. And down. I said we're going to do the both side. So let's do the both side. Arms up to the T. And we're pretending to fly like a buzzard. And next exercise, we put these arms up. Let's see, arms up. And breathe out. Open the arms to the side. Breathe again in. And out, open the arms to the other side. Again in, the arms up. And out and down. Now with the legs around shoulder with wide apart. And we turn up, shoulders back, breathe in. And out and turn the head over to one side. And your chin down to the plank. And breathing in. And out, lift the gaze. Turn the head over to the other side. Breathing it in. And out, bring the chin down to the plank. If you can lift the gaze. And over to the first side. Again, chin down to the, no, not down. Breathe again in. And now breathe halfway out. And circle the head over to the other side. Breathe again in. Breathe halfway out. And bring the head and circle over to the first side. Again out. Now have the feet standing together. Breathe and lift the arms up. And breathe out, doing the crab in the morning. Draw the shoulder blades together and open the chest to the sky. Breathe again in. And out again back. Draw the shoulder blades together, open the chest to the sky. Again in. Bring the hands together and lean back, the feet in the wind. Again in. And out and back. Again in and turn the. And breathe out, lean over to one side, firm the wind. Again in. And out to the other side. In. And over across the arms, the 20 fingers that reach high with screw. And breathe out, reach the front and hold the back with drill. Again in the arms up. Over across the arms, the 20 fingers reach high. And out. Reach in front, hold the back. Breathe out. Again in up. And out and down. Now the catch. The feet are standing together, intertwine the fingers behind the neck. Hold up, shoulders back, breathe in. And now turn the head over to one side. And bring your chin down to the cloud. Now breathe in. And out and reach with the hands down to the floor. Breathe again in, lift the gaze and turn the head over to the other side. Breathe again in. And out, bring the chin down to the clavicle. Breathe again in. And out, reach with the hands down to the ground. Again, in lift the gaze. And turn the head back into the middle. And now we stretch your Venus. Intertwine again the fingers behind the leg. And bring them over to one side. To one up, shoulders a bit back. Breathe in. And out, turn the head to the side where the hands are. And the chin down to the clavicle. Now breathe in. And out and pull the arm and the shoulder down. Again, head up, turn the head out to the other side, the arms also out to the other side. And breathe, just breathe in first. And breathe out the chin down to the clavicle. And breathe in, pull the arm and the shoulder down. Breathe again and lift the gaze and then head back into the middle. Now the sky hugger, feet are standing together, breathe in, lift the arms up. And breathe out, open the long arms up. Again in. And out, lean the second time back. Again in. Out the arms down, as we do the eagle's wings, coming to the end. Breathe in, lift the arms slowly up. And breathe out, the arms again down. Again in, the arms down. And out the arms down. And last movement, the cactus collecting its stings in the evening. Breathe in, lift the arms up. Bring the hands to touch and lower the hands slowly down to heart center. That was the neck stretching. I thank you very much and until next time.